my classmates and I talked about having like almost imposter syndrome. We're like, we're nurses, but now we're going to be providers. It's a
Yeah,
completely different shift. Um,
yeah.
but I was going over something with another NP student at work, and just as the way I was teaching and talking, and I'm like, you know what? I do love this. I do really like what I'm doing in both avenues, being a leader and also being like in a provider role. I can see myself doing both.
All right, let me. Mm, that is good. That is good stuff right there. Coffee. I think it's sacrilegious to drink lukewarm coffee. That's just me. My wife, she doesn't drink coffee anymore, but I remember one of her first squabbles when we were living together before we got married was I'd make a pot of coffee and she what would she do? Oh, she she would fill I'd fill my cup up, she'd fill her cup up and she would drink her coffee very slowly and then it would get to the halfway point and it would get lukewarm and she would refill her coffee again, not finishing the cup, but just to keep it hot. And then when I wanted coffee, um, it'd be nothing left for me to actually drink my second cup. And yeah, I could make more, but it was just something I remember we were we were arguing about a little bit. Normal stuff, normal stuff. I don't know what I would do without coffee. I was in the sauna yesterday. I started going in the sauna and never had done the sauna. I totally underestimated it. It is not easy. I had to build up to 20 minutes, but I remember a guy who was talking to his buddy about you shouldn't have more than I can't remember the number. It comes to like 2 cups of coffee a day. And I said, boy, if that is correct, I am in trouble because I love coffee. I have an emotional response to coffee. I try to hydrate as best I can, but I love coffee. I can have for anywhere between 5 and 8 cups a day. That's how much I love coffee. I know. And I'm a nurse. I know better. I don't endorse that. That's just me. But welcome to the Nurse Dad channel. I am Glenn, aka Nurse Dad, former Navy hospital corpsman and current ER nurse. I am really excited about this episode today. I get to interview an old pal of mine, former colleague. That's one of my favorite things to do with this podcast is I get so many great guests, but once in a while you actually interview people you worked with and you know. And Anastasia, she has had a unique history. She's been a nurse, an outstanding charge nurse, and now she's a nurse practitioner. This is a track that a lot of people who are in nursing are considering or are actively pursuing. And I think we can all use a little bit of advice or just to see someone else go through it or having gone through it, see what they did. Maybe there's a few tricks they picked up along the way or a few warnings they can give us. So just, kernels of wisdom. So I'm going to interview Anastasia. You're going to see this. I worked with her in Queens, New York. That was my first gig in the emergency department. And it was a doozy. I have worked in many emergency departments as a local travel nurse. When I say local, what does that mean? It means that I live in a certain region, a certain area, and I don't venture too far from that. But because of the fact that I live outside of New York City, there are a lot of hospitals, a lot of healthcare systems. So I have been everywhere, and nothing was as busy as this little Queens hospital, 100-bed emergency department. Yeah, it was. It was a busy place. But I tell you one thing, you learn how to rock that place, you can rock anywhere. It's like that song, right? You make it here in terms of New York, you make it anywhere. Same thing with the hospitals. For those of you watching on YouTube or just want to get to know me more, please visit my website, www.mynursedad.com. When you go on the website, there'll be a pop-up to a free guide. The pop-up's not very visual at this moment. It will be. It's basically a guide I made for those who are in college, any type of degree that you're pursuing, who want to get good grades, but don't want to give up on their hobbies. Just a few tricks that I developed. I was a freshman at like 32, 33 years old, I believe, 31. I can't remember anymore. But there were just things in life that I was not willing to give up because of nursing school, and nursing school is intense. And I developed a few things that allowed me to. I got a 3.5 GPA. It's not amazing, but it's also, I think, for me, pretty damn good. I'm proud of that, cum laude. But I still worked out 5 days a week. I still did activities, still enjoyed myself, went out to bars. And these are just things that I did, tricks in terms of studying that I thought I would share with people. Also, multitasking is in there. There is my 2 cents on how to multitask as a nurse. Just couple of things. I call them majors and minors, especially if you're a novice nurse and you have like no idea how to go about it. I was talking about Queens, and when I was there, I remember questions like how do you manage all of this stuff? How do you have 10 patients, people coming in, and how do you know what to do first or how to get things done per patient? What's the fastest way to do it? So these are I put that in there. I also put a nursing sheet in there. In my career now, I kind of write on a piece of paper or a napkin or something like that. But the nursing sheet really helps, especially if you're a new nurse. Organize your thoughts, see where your priorities are. And I see a lot of nursing sheets that are just not made by nurses. It has a lot of information you don't need, just a waste of space, no room for notes. So I made a nursing sheet that when you download this guide, you can just print out that paper, make a whole bunch of copies, use that. And then one more thing on this guide that I put in is something that the Marines taught me. I was a Navy hospital corpsman. I was attached to Marine units, whether artillery and infantry, all that kind of stuff. And there was just a theme that I kept witnessing, juxtaposing that experience with my life experience. It seems to be the number one thing that holds people back, and especially when times get tough. And so I put that in there. So whether it's for yourself or someone I believe you will benefit from this guide. So go to www.mynursedad.com. You'll see the pop up. You just put in your name, your email. I'm going to start a newsletter that's slow going, but I'm going to get on that. Also, please like, share, and subscribe and comment if you like this channel. The algorithm is a beast. It chooses what it promotes, even if you subscribe or not. So by liking, sharing, subscribing, and commenting, it does a lot. I just want to get this information out to people who may need it. So having said that, let's finally get to my interview with Anastasia, nurse practitioner Anastasia. I'm not sure what to call her anymore. Badass, I don't know. But without further ado, let's kick this big. Are you still you still Queens? Still same
Yeah.
same place?
Yeah, I'm
Do-
per diem there. So I was per diem after I started clinical. So I'm there and then while I wait to start full time somewhere as an NP. Just being a little bit picky as to what I want and then trying to hone down exactly what I want. So I've been per diem there for like about a year and a half, but it's good.
What so you're gonna be an MP there at the same
Oh,
hospital?
no. So depending, because they do only like mainly cardiology outpatient there.
Yeah.
And I'm looking for maybe it's still outpatient, but I wanted to do like primary care gerontology, eventually
Okay.
maybe palliative care. So I kind of
Yeah.
my skills and going in that direction. But also I'm really good. I was told that I can go leadership. So I'm trying to decide if I'm going to do the leadership route and go into like management. Um,
Okay.
is like provider or kind of be like kind of do both, like full-time management, part-time provider. So I'm still kind of figuring that out. As a new NP, I kind of have a lot you know, to play around with right now. So I,
I the biggest allure for that for me is the remote, especially as you get older.
Mhm.
You never know what life will be like. We all don't get to retire like we planned, but to be able to, be an MP, have
Mhm.
that salary, but extend that remotely because obviously
Yeah.
you're prescribing meds, you're treating patients. Well, that's pretty cool. That's like a big allure.
Right. So my husband is also very big into that. Like eventually when we do have a family, like that would be great, like telehealth. So I'm kind
Mhm.
of trying to want to hone my skills into maybe being able to do that at some point so I can like work from home. I can have like a block of time. I'm like, okay, I can do telehealth with that or something remotely. And I saw some options that I applied to, so I'm trying to see how it is. And if how
That's
it
it's
would
probably
be.
the future,
It is, yeah. It's
you know?
we saw that happening after COVID. So
Oh yeah.
Yeah, people thought that couldn't happen, and then lo and behold, it happened. So,
Especially as we get away from screens and they go into like the VR realm or augmented reality or whatever they want
right.
to call it. That's going to be kind of nuts. Like imagine seeing a patient in a virtual realm where you're standing next to them, and that's it sounds far-fetched, but the way things work, like 5 years, 10 years, you're doing it. Watch.
Right. I believe you. I can see that happening for sure. Completely. Yeah, because you have the telemedicine and they have like remote ways of speaking to patients. One of the jobs I applied to, they want to do you go in and you see the patient in their home, but then you can actually just video call them after that to follow up. And as you said, I think that eventually they'll find some way for you to kind of be there, but not really being there, but,
Yeah.
so.
So for those listening or watching, just to catch them up, I started working with you in 2019 November, right before 2020.
Mhm.
It was my first emergency room. I had come from a step down ICU unit, and then
Mhm.
before that, military medicine. I remember that was when you still had to kind of audition for the ER. You couldn't
Mhm.
just come out of nursing school. You really, now I feel like they want to hire new nurses out of nursing school. But at the time, I still had to prove myself. I have to say, I've worked as a travel nurse, local travel, some pretty huge hospitals within varying healthcare systems, but nothing got quite as busy as Queens. It's a different breed over there.
For sure.
From the walk-in, from the foot traffic to just the amount of ambulances that could be coming and
Hmm.
dropping off patients. Yeah, what we did there, I feel like I'm watching this show, The Pit. I don't know if you've seen it,
Oh
but
yeah, I see it. I love it. Yeah.
yeah, I love it too. But I feel like the closest experience to where I could be. I mean, it's a show, so they're doing like crazy procedures of one patient after the other, but the rhythm is very much like
Hmm.
Queens.
Oh yeah.
I feel like, and some of the aggravation and some of the key moments that are quite lovely. I feel like it just all reminds me of Queens.
Hmm.
Anywho, before I got there in 2019, when did you start working as a nurse there?
So I started in June of 2015. So when I first became a nurse in 2011, everyone wanted you to have experience. And I'm like, so I'm a brand new nurse. How am I going to get experience? So I got my
Yeah.
experience in a nursing home for 3 years. So I was in a nursing home, and that's a different beast because some
Yeah.
of the floors had like 50 patients, and you're just trying to do med pass in 2 hours and trying to learn the patients and who needs crush meds and who needs, medications at a certain time because their behavior will change. So I
Well, it's a
got
good setup. It's a
it
good
was
setup because you have to improvise and you don't have
oh yeah,
enough. And I
yeah.
mean, and
I
I
think
guess
it
from the
really
ER perspective, I'm sorry, I don't mean there's a
no, no,
delay in the
sorry.
video. No, continue. No, no.
No, sorry. I said it really set me up for the ER in terms of like speed. You would never think that in a nursing home, but it definitely put some perspective into when I first started in the ER because I never thought I was going to be an ER nurse. I thought it was going to be
Oh,
too
no.
daunting for me until I actually went there and I'm like, this is my place.
Yeah.
Yeah.
Was it
So.
the camaraderie? I know my biggest thing coming from I was Navy hospital corpsman. I was working with Marines in the field and also in a clinical um, arena. But the ER reminds me very much of that camaraderie that I'm used to, first name basis with the doctors,
Yeah.
especially when you get a good groove with a particular physician or PA or MP. I don't think we really worked with many MPs in
Oh,
that
we did.
facility, but a lot of PAs, a lot of physicians, other
Mhm.
nurses. It's the camaraderie and the chaos and the fact that you do have new people coming in. You're not typically you don't want admitted patients to be in the ER for too long, but
Right.
um, which does happen. But typically you're not sitting on a patient for 2-3 days or whatever shifts in a row. You're going to have new people every
Mhm.
shift. Is that kind of what you liked?
I did like that. Because I always liked bedside nursing, and I still think a part of me, I like the connection with my patients, and I think that's why I went into primary care nurse practitioner because I wanted to continue that relationship. But yeah, the camaraderie you talked about, like we're still a huge family. Like we're still a part of each other's lives. We call ourselves our second family because we spend so much time together. But it's still there. And I do like the fact that I'll see my patients come in, I'll treat them and release them. Either they're going to go home or they're going to go get admitted or transferred out. Um, and kind of seeing that process. And I like the speed of the ER and just the chaos and predictability of it. So I think if I were to be, so I think for me, a little bit of an adjustment is to get into that predictable life
Yeah,
versus coming from chaotic, unsure. So I think I would have a little bit of an adjustment, but I think I'm ready for it. I've been an ER nurse for almost 10 years, so I think I need
yeah.
to transition myself out slowly now.
That's kind and just to give context for where we worked, where I worked, where you're working, you can get as a nurse 12 patients, 10 to 12
Yeah.
patients. It can happen. You
Yeah.
know, a lot of places I've worked since they've had a cutoff of 8. That's kind of a privilege. That's not something that you could expect in Queens. And you have to kind of meet the demands
Mhm.
of the city. The city does what the city does, and we have to all adjust for it. That's kind of how city life is.
Right.
I You were in a leadership position then,
Mhm.
and you spoke about perhaps going into a leadership position as a nurse practitioner. Some people they fall into leadership. Some people, they're asked because that's how they are. Some people pursue it. This sounds like something that you pursue. Do you like being the charge nurse? Because when I worked with you, you were the charge nurse fairly often. Is
Yeah.
that something you gravitated toward? Is that something you wanted? Were you asked for it? How does that work out for you? And
Okay.
on the second part of that is what is the key to being a good charge nurse?
Okay. So, well, when we first started training, because we started off with about 14 new nurses because we moved into a larger space. So when I first started that first
Right,
year, we had a small ER and then we moved into the larger ER that they built.
right.
So
It was a
after,
six-floor hospital, but a 100-bed emergency
yeah.
department that spanned the whole width of the hospital.
Correct. Yeah, exactly. We started in a very small, I call it like almost a coat closet, like 14, 15 beds or something like that. And then we
Wow.
expanded. It was crazy. So it was quite a transition. So after about a year and a half of actually being there, I went into a triage position where my manager said, okay, we need to start training you for the critical care room, which is the resuscitation room, triage, and then charge. So I kind of was put into that position. And I really found my ground and my footing. And honestly, I didn't know I had it in me to be such a great charge, and I've been told that I am. And I still, as a
You are.
per nurse,
I can attest to that. You're great.
thank you. And still, as a per diem nurse, I am one of the only per diem charge nurses. So if there's a need, and say someone calls out sick or there's not enough
Right.
charges, I will step in, which I had to do the other night. And it's okay for me, and I like that role because of just the way my mind is. I'm very meticulous, and I can
Yeah.
literally do 10 million things at the same time, and I'm focused on all of them.
And to reiterate again, an emergency department in Queens, it is a
Mhm.
lot to manage. I did a contract in Nassau County outside of Queens, and it was a huge facility, like a campus type of hospital. And as busy as they got, and they got close, but they still were not as busy as we would get. I mean, I think sometimes some mornings at 7 a.m. you'd come on duty and you could still have 40 to 60 people in the emergency department. And then at night it can get to 100. I mean,
Oh yeah. Oh yeah.
it's pretty insane. And you might have eight nurses on the night shift. You might not have too many more on the day shift.
Right.
It's so when we're talking about you being a charge nurse, you directing all that energy, I mean, it's a monster and you're taking that on. It's beyond what maybe some people can imagine
Oh yeah.
an emergency department to be.
Oh yeah. Because and the thing is like also because we have a lot of new nurses right now coming right out of school and they're training. So I have to be cognizant of that as well. So I kind of have to see everyone's strengths and weaknesses, where to place them and figure out that assignment. I came in the other night and it was extremely busy and they had somebody who was very hypotensive and then needed to be taken to the resus room, but it was full. And I'm like, okay, the only patient that can come out was the one getting a central line. So I'm like, as soon as that's done, that patient has to move that person in because that poor nurse is freaking out because she's like, oh my God, I'm new. Suppose I have to do this. I'm like, it'll be
Mhm.
okay. You have to be the sense of reason, just like be calm. The biggest thing, even inside of me, I'm screaming. Outside, I'm like, I'm very calm, reassuring. And I think
Yeah.
those are great qualities of a leader. And I've been told that. So, um, I think I'm leaning a lot towards that, and I think I'll be great with it. So I'll see what opportunities come my way. I have a few things in the pipelines. I'm hoping those things manifest in the next few weeks. We'll see.
Responsibility is addicting. Once you get it, it's one of my
Yeah.
biggest kind of, I don't want to say discontent, sounds pretty negative, but as a corpsman, I was able to treat people many times, provide a higher echelon of care. You know,
Yeah.
I could do it, you know, with whether it's doing a nerve block, or removing a toenail, or prescribing antibiotics, or whatever it was. That level, that's might be one of the reasons I want to become an MP one day, because I kind of want to get back to that, but or that kind of leadership. But you've enjoyed a sense of responsibility, rocking the charge nurse thing, and I would imagine as an MP, you don't just want to start out as on the lowest tier. You want to maybe promote yourself and show people what you can do in the leadership position. You've had a sense of responsibility. You probably want to maintain that to some degree.
I think that's it. And I see that as well from my manager who, she kind of just guides me with that. She's been a great mentor. She's still there, so she's been great.
Okay.
And some of the other managers that I'm very close with on the overnight. So, I've had some good advice from all of them because I wouldn't really go into something that I wasn't 100% sure of. I'm like, okay, if I'm getting a lot of people telling me that, and I know I'm going to have a lot of people to turn, like kind of use as a sense of resource, going into something that's very new for me. And as much as it's scary, even as a provider role, like I was initially when you're in school, you're like, my classmates and I talked about having like almost imposter syndrome. We're like, we're nurses, but now we're going to be providers. It's a
Yeah.
completely different shift. Um,
Yeah.
but I was going over something with another NP student at work, and just as the way I was teaching and talking, and I'm like, you know what? I do love this. I do really like what I'm doing in both avenues, being a leader and also being like in a provider role. I can see myself doing both. Um, and I think eventually I will be at some point doing both at some point at, essentially maybe one part-time, one full-time. And I can see
Yeah.
myself doing that because I do enjoy it. And I would not have been a nurse if I did not. Anything that we have
Yeah.
learned over the past, especially during the pandemic, if you did not like this, you would have been out of it
Yeah.
already. So,
Yeah. You and I, just to touch briefly, because that would be a whole different podcast. We encountered COVID together, 2020. I mean, people at that time, I remember people, there were several people in Westchester that they were following, but we're in Queens. So
mhm,
I show up one night. Um, it was 8 nurses on the night shift, 108 people
mhm,
in beds.
yeah,
They came from other countries. Before they shut the border, we're in Queens. People are going to fly to New York City for
right.
care. So there might be a dozen people in Westchester that they know about with COVID, but
Hmm.
we were hit hard in Queens, and well, obviously other boroughs. But
Yeah.
yeah, that was intense. That time, that was a real test of metal. I think yeah, that was incredible to have. And in Queens, like I said, we were hit hard in Queens, and we were kind of setting the pace
Hmm.
for everyone else. For MP school, did the hospital pay for it? You were staff, you were there for a while. Did they contributed to that, right?
Right, because if you're in a union and as a full-time worker there, that particular union will cover. I went to
Mhm.
a private university, so they paid about 85% and I paid out of pocket about 15%. If I were to go to a CUNY or SUNY, they would have covered everything.
Mhm.
It's
Yeah,
just
and I
it
could say that it's
Mhm,
not a lot of hospitals do have a tuition assistance
mhm.
program, varying degrees of assistance. What
Yeah.
made you choose the private over the state? Was it just convenience factor?
It was mainly a convenience factor because where I live right on the border of Nassau and Queens, and the school
Mhm.
I chose was about a 20-minute drive for me.
Yeah.
And as much as everything was mainly online or in Zoom, there were some days I would have to go in for like exams I would have to go in or for simulation labs.
Yeah.
And I'm kind of like a contact person as well. I like to be in
Yeah. Me too.
school. So just being able to interact with other people and my professors. So it was a good balance of a good hybrid program. So even though most of it was online and the lectures, I really did like having to go into school for certain things. So that was one of the reasons. It's a really good, well-known school for nursing.
Mhm.
Um,
Yeah,
and
85% coverage. That's great. I
yeah.
feel like actually going to school is the first level of studying because
Hmm.
it's like you can go, you take an online class and you're like, okay, and then you got this mountainous information that you have to try to engage. But
Oh
it's like
yeah.
if you actually go to class, like in nursing school, I print out the PowerPoint, I take notes during class, I listen, and it was like it was I could probably understand most of it
Hmm.
just by going there. They took a
Yeah.
lot of the sting off of having to, or in the fright, right, of having to
Mhm.
engage new information for the first time.
Yeah,
Um,
for sure.
yeah,
The first year it was easy for me because it was mainly like papers and like your core classes. But when you went into like the meat of it, I wasn't in school for like what 10 plus years, and then I decided to go back and do my master's. So it was an adjustment for me. Like some things had changed in school. I'm like, okay, so I have to
yeah,
kind of like know how to do exams again. And like I was the first
oh
exam, I
yeah,
was so nervous. But once I kind of like, and the thing is, going into school, you meet your classmates. So I kind of formed
yeah,
a bond with a few girls, and we were study partners. So it helps a lot, especially when you in that level of
hmm
study. You really need people to like just like really, you might not ex understand the concept, and they'll explain it, and vice versa.
hmm
And honestly, that program is one of the best programs in New York. I was looking up some articles about like online programming programs and stuff. And that nurse practitioners coming out are not as well-rounded as we were at the school I went to.
okay,
So some places do not offer like sim classes. So like with the simulation classes, you go in and you literally have a patient and you're going through the whole head to toe assessment, diagnosing, treating.
yeah.
So it was
I
rigorous, but it was really beneficial in the end.
yeah, I know you're saying in terms of getting used to going back to school. I went to nursing school on the GI Bill after military. I was like a 33-year-old freshman. And even taking certain math classes in the 90s, you could depending on your tract. I finished math at like 15, 16. I was done. And that was the
Right.
last time I took a math class. And now here I am, 33,
Mhm.
taking math for school. And you were saying in terms of support group, most of my peers were many years younger than me, but I was surprised by how many individuals I gravitated toward. You really do in nursing school. You really do need alliances or friends,
Oh,
buddies, and there will be people, even if they're not even elective classes. You will need people with certain skills
yeah, yeah.
that they're just better at you. Just can help you along.
Hmm.
I wanted to ask you. Obviously, you go to nursing school. Most people have no nursing experience. You're an MP, you're going to MP school, you've been a nurse for 10 years. What are the big differences, aside from where you are in life, between nursing school and nurse practitioner and going for your nurse practitioner? Like, for example, in nursing school, clinicals, you're kind of a glorified tech. You're doing vital signs. You don't really do much. But I would imagine as a nurse practitioner, now you
Oh,
have to learn how to prescribe. You really need to know what's going on with people.
oh yeah, sure.
So describe that. How is it? What is that like?
So I think being a nurse, and I tell this to a lot of new grads who want to like, so some of the nurses I work with right now, they're about 2 years out of nursing school and they want to go straight into NP school. And I'm like, that's
Mhm.
great. But I think I'm like, once you get that experience, going into NP school is so much easier. Things start to
Yeah,
make sense as you go through your A&P, as you go through your diagnostic and reasoning. A lot of different classes will start to make sense to you. And
I would imagine, especially on the pharmacological. If I did not say
oh,
that
yeah,
right,
yeah, yeah.
pharmacology. Um, you know a lot more about the meds that are used, why they're
Right,
used,
exactly.
contraindications.
And knowing exactly what side effects you're looking for, like really
Yes.
understanding those things. And then a lot of things start making sense and clicking. And then you start your way of critical thinking and the way of you really, understanding the whole material makes so much more sense. So in
Yeah.
clinicals, my first clinical was a physical assessment clinical. It was just going and, my professor kind of just went in with me. I had to ask all the questions, come up with a diagnosis, and then talk to her about it in the end. And then I kind of built on that throughout the semesters in different settings, a primary care office, a nephrologist office, and then an urgent care. So the urgent care, you're seeing every kind of patient. And I feel like as an ER nurse, it kind of helped a lot with that. Like just think of us
Oh,
in,
I would imagine.
right? So it's like a fast track, but just like everything else you're seeing, nothing too emergent. So just knowing
Because
exactly,
not to cut you off, I just want to jump on that for real quick. It's not even, I don't think people realize it's not even what you know, what you don't know. Just the pace is
right,
incredible. Going
yes.
from this patient to that patient to this like that in itself sometimes requires a year, 2 years, just for that, just to think under
Right.
those conditions. Not even a code, just
Yeah.
seeing this many patients.
Well, depending on I guess the urgent care where I was, it was very specific. It wasn't the hype, the volume wasn't that intense.
Mhm.
And I think I was talking to the NP there. She said, if I were to work there, I would have to adjust to that pace because I'm used to a faster pace.
Right.
And I've spoken to other people that work in urgent cares and they're like, it's busy. Of course, not ER busy, but it's different. But knowing exactly the questions to ask your patients, and your mind has to be thinking quickly about differentials, and now you have to prescribe
Yeah.
medications, treatment, and all of this for the patient. So
That's got to be the nervous part. Like,
that's the
okay,
nervous
it's
part. Yeah,
on me now. Like, this is
yeah,
what I think it is.
right.
Do you consult? Do you have like a PhD, like a physician there? Is it um is everything that you do overlooked by somebody, at least in the beginning? How does that work?
Usually in the beginning, so New York State laws, I have to work under a physician and accumulate 3,600 hours. So I will have pretty much like a contract with that physician. So that person will overlook whatever patients I see. If I have to ask them, a lot of the times, especially if you work outpatient, you have a physician you're working with. So you
Yeah.
can always consult with them. So my thing was some of the places I interviewed with, that was one of my questions. I'm like, what's the support like? And we had a long talk with my professor when we were leaving school. Our last talk was ensure that you have support and do not get dumped on because a lot of new NPs, they're just like, okay, you're here you go. You have all this caseload and now
Right.
you're overwhelmed and all of that. So yeah, it's very important to make sure when you're coming out of school and you're being discerning with who you go with, like who you're going to be working with. If there's that support, you will thrive very well, much. Because of course, you're coming out, you're like, I need to prescribe zithromycin for this versus something else.
Yeah.
You're thinking it out loud and you have access to database, of course, and you can check, you're not in school where you're having a test. You can check online and check, there's all these resources for you, but yeah,
Yeah.
there are people out there that will be there to support you.
That's great. You've juggled a lot. Describe what your typical day or week was. You're working per diem now. You're going to school. You're
Mhm.
married. How do you? What's like the secret sauce here? Because a lot of people they think about it. I mean, you don't have children at the moment, right?
Oh, I don't have children at the moment.
So
I have
that could that
cats and
that definitely
dogs.
helps.
Yeah.
Yeah, that helps. But still, it's overwhelming to a lot of people to consider that. What was your routine in order to devote yourself properly to each thing, like your job, your school, your life? How did that work?
So it was balance. Initially, it was really difficult. So my husband and I had a talk because he always wanted me to go back to school.
Yeah,
So we'll talk about him because he was deployed as well. He's in the army, right?
yeah,
Um,
I want to get to that too.
Yeah, so when I started school, he used to be an EMT when we started dating, but now he's a police officer. He's an NYPD officer. So when I started school, he had started the academy, the police academy a few months prior. So
And
he
he's in
kind
the Army Reserves as well, right?
yeah, he's
Yeah,
yeah.
mhm,
So he was doing a lot of things. So
yeah.
he was in the Army Reserves and he was also he's a cop right now. So we were okay. We had a plan. We really talked about it in terms of support. And then we got a dog in the middle of all of me starting school. So I think for me, initially it was difficult because I had to find like a balance of, I was working full time up until maybe a year before I finished school. I was working full time. So I had to pretty much set my schedule in a certain way. And I had to every day, like I work nights. So of course that's
Yeah, that's
a
tough.
whole different situation as well. And then eventually he was working nights as well too as a cop. So my days were pretty much, if I had a day that I had to go to work, I'll get up in the evening at 4:30, have dinner, walk the dog because he'll already be sleeping. I go to work, I come back, I sleep the next day, I usually go to work. But then I would always have to make sure I dedicated that other day, like this is my school day. I have to do it. I have to be on a schedule, and I made myself a schedule for the entire school process for the 3 years. And if I fell off of that schedule, it kind of screwed things up a little bit for me. I think
Hmm.
the first year wasn't so difficult because it was mainly papers and reading articles. So in my downtime at work, on my break, I'll read those articles, make notes, come back home, type it up. When I had to study, it
Okay.
was very difficult. Um, my very first, so he was in the yeah, so he was in the reserves. So he got
Yeah.
deployed he left to go training in June 2022. He had to go
Mhm.
to Fort Drum for training. So that day I dropped him off at the Javits Center, driving home crying. I had a quiz that
How long was that deployment? Was it like Army
a
deployments?
year. It was a
Yeah,
year.
it's a year. Yeah, I'm used to
Yeah,
7 month Navy deployments. That's a year. Okay.
right. So he was gone for a year. So he had the training at Fort Drum from June to August. And he was able to come back for a weekend in August. So I was able to see him. And then he flew out that September the following week. But I literally had to stick to a schedule. I'm like, if I do not, because I was in school that summer as well. Honestly, it was a curse and a blessing because
Mhm.
because of that schedule and being regimented, it was
Yeah.
difficult to miss him or to feel like lonely and sad. I had to get up. I had to do these things.
Yeah, that's true. You didn't
So
have time to dwell. You had to move.
exactly, exactly. I didn't have time to dwell on all of that stuff. One of my first clinical, I my professor set up a clinical for me all the way in Riverhead. I live in Floral Park, so I had
Oh,
an
wow. Yeah,
hour
that's far.
drive.
That's past me.
Yeah, so I had to
Like
drive
30 minutes past me. I'm out here too, out in Eastern Long Island. But yeah, from the Nassau Queens border, that's a long drive.
a long drive, and my clinical started at 7 a.m., so I had to
Oh my
wake up
God.
at 4:15, get
Yeah, that's
ready,
tough.
walk my dog, and leave by 5:40 to get over there. So
How
it was.
long? How long was your clinicals? I got lucky where I was
Mm,
in PA, Philadelphia. I went to Drexel University.
mm.
Great school.
Oh
But
yeah.
our clinicals were not 12 hours. I'll say that. Got lucky with that one. But how long were yours?
It varied on the office that I was in. So when my first was an ambulatory clinic, surgical, like pre-surgical clinic. So that was 8 hours. Um, so some from 7 a.m. to 3 p.m. So it wasn't terrible. And then my second clinicals were I was in a primary care office. So her hours varied. Some days were 8 hours, some days were 10 hours.
Okay.
And the nephrologist office, 8 hours, but then the urgent care was 12 hours. So
Okay.
I
Yeah.
had a feel of a little bit of everything. So
Yeah, I mean that's another thing too, is that the endurance that you have to have. You really have to be in good shape physically, mentally,
oh yeah.
um, which takes on different appearances for different people, but it's man, like I worked a shift recently where I didn't get to have my cup of coffee till 6 p.m. It was just ridiculous.
Yeah.
And when you're not at work, you're like, oh, I got to go to the bathroom. Oh, I'm a little thirsty. I got to, you just, I'm like spoiled. And then I get to work, and it's like, oh my God, I haven't had a drink of water in 4 hours. I didn't. How did that happen? It's really insane.
Yeah.
What
On
you
my
get
drive to
used
work,
to.
I have this.
Yeah.
I make sure like I have like sometimes an energy drink or I have like I make sure I hydrate before. And I've learned that the hard way. I'm like, I have to do this because one shift I was so dizzy because I was so
Mhm.
dehydrated.
Yeah.
Because I was running around so much, but I'm like, just like little things I have to keep at the back of my head. I'm like, I have to do these things to make sure
Mhm.
that I'm okay for myself so I can
Yeah.
take care of patients.
You want to have a healthy life. You're not going to age well if 3 days a week you're just not hydrating or eating properly. It's going to stack up. You can't,
Right.
so. at some point you have to take care of yourself as well. Try to work little tricks of the trade,
Mhm.
whatever you got to do. Uh, yeah, that's tough to get used to.
Yeah, for
I
sure.
want let me see. Oh, yeah, I wanted to give you credit because being an army wife, being a wife of anybody enlisted or officer who gets deployed,
Mhm.
I can't tell you, like on deployment, like I wasn't married on deployment. I certainly didn't have children. But you could tell how good somebody was based on how the home front was.
Mhm.
You know, a lot of people they think they could handle it, and for good reason. Their wives or significant other husbands, they're at home and they can't stand it. They're resentful or they're whatever it is. It's just not. There's trouble in paradise, and you can see it on the Marine's face, sailor's face, a soldier's face, whoever's. You could just tell. So, um, I give you a lot of credit. Were you part of a military family, or is this something you kind of just gradually developed and got used to by being with him?
Just like I used to it. Like a lot of my cousins were in the military, had one in the
Uh,
army, one in the navy, and one in the Air Force. But
okay.
I was never like, military family. And he always told me he wanted to. So when we started dating, he had signed up and he went to basic training. So I kind of had a taste of what that was like. And I didn't
Mhm.
think in that he would ever get deployed because I'm like, oh, when you're active, maybe that's when you get deployed. And then
No, no, no.
his unit got activated, and I kept thinking I was
Yeah,
just
they
in
get activated.
denial. I was in such crazy denial until the day he came home and he's like, "It's actually happening. It's going to happen next year." And I'm like, "Oh my God!" So it really
And a
hit.
year, 365 days. That's a long time.
It's a
Seven
long
months is
time.
7 months is a pretty good number. 7 months.
Yeah.
Okay, so a year is a lot. That's a lot.
It's a lot. Thankfully, for the most part, we were able to be in contact via phone. Even though there
Mhm.
was like a time difference, we made it work. We'll figure it out. A lot of the times when I'm driving to clinicals early in the morning, it's like in the afternoon or evening for him, so we'll have a little chat or
Yeah.
whatever. We figured how to do things. We downloaded this cute little app to like that we play the almost like games with each other, like just answering
Oh,
questions
that's
about
cool.
relationships. It's called the pair app, I think, or something like that. And then we'll talk about our answers and just try to build and strengthen our own relationship. Because
I think that comes from your medical background. You know that you can't. A lot of people I find they don't move in many ways, mentally, physically. Like you
yeah.
have to do tasks, you have to do things. You can't just
Mhm.
sit there and think about how much you miss somebody.
Exactly.
Um,
Yeah, I
yeah,
agree with you completely. And the funny thing is when he got sent to training in June and we got married at March. So we were only married for 3 months and he was less than 3 months and
oh
then he was
man,
gone. So
yeah,
we were like newlyweds and we were had a mini moon because we were when he came back, we were like, okay, we're gonna have our big honeymoon then.
yeah.
So it was a lot, but we knew in the end game, like we knew exactly what we wanted. I was in school. I had a career that I wanted to continue going down, and then he was gonna come back and continue because he was already in a police officer by then, but I think it takes a and he talked about honestly what you said that you know exactly what was going on in the home front by the your Marine or your Army buddies, and he said
They're good.
oh
They wear it. It's on their
right
face.
there it's on
Yeah.
their face and their
Mhm.
behaviors, and a lot of them were like young men or women, not my husband was
Mhm.
older, he's in his 30s, so and he was also a combat medic, so they'll be like doc and they'll go talk to him and
Yeah.
everything. But
Yeah. Yeah. They no, they would talk to me about it too. So I got a little bit more insight of just how much it bothered
yeah,
people.
yeah.
Some people don't often talk about this or bring this up, but what was your self-care like during all this? It's very easy to talk about what people do, what they're going after, their work, their studying, but we're not machines. And like, did you take time? Were you able to take time out for yourself? To try to get your mind right. Like I know when I was in school, I kind of I incorporated studying with the gym. I printed out everything. I brought it with me. The gym was something I had to do. I had to sweat out my frustration. I went on bike rides. I treated myself to. created like a little like, reward system for myself for putting in a certain amount of work and then rewarding myself with, whatever hobby I'm into. Did you do anything like that or no
To an
time?
extent, to an extent, I try to make some time. Like I think for my work family, we would at least try to like, hang out together, or just like spend time together, or my own best friends.
Yeah.
We would so a lot of the times, like if we can't see each other, we would make video messages to each other. So as we were driving to work or driving home from school, whatever it is, we'll make video messages and just update each other in our days or vent about something. So there was an outlet. So if I was having a bad day, I'll make a video message and send it to them if I can't speak to them at that point. So they were that great resource, absolutely amazing friends that I
Mhm.
have. And my husband's partner in the PD, his wife was also a great resource because I'm army wife, but I'm also a police officer wife.
I
So
was actually going to get into that. Have you joined any kind of community for military wives and police wives?
yeah, on Facebook I have police wives, but I have a book. I can't remember the name of the book right now that I'm going to start reading just to get. I think there was an adjustment when he came back, really understanding what it was like to be a police officer's wife.
Yeah.
But I think that came quickly to me. I'm like, okay, I'm used to him being away. So,
Hmm.
when he had an arrest or anything and he's gone for like a whole 48 hours or he has to go
Yeah.
for overtime and the disappointment of not seeing him. So, as much as the beginning it was difficult, I think as time we really like talked about it, the communication is the key, honestly. Like
Yeah.
I just know how to read my husband. If he's having a bad day, I know how to talk to him. I know when I have to leave him alone and let him be. I know when he doesn't want to talk to some about something. And that's really, I think, takes time and really that love and understanding that plays a huge role. And unfortunately, a lot of there's a high divorce rate for PD police officers.
Yeah.
So, they see a lot and the things he sees. And I think having also an EMT background and a army background because he's seen a lot in the field. So those things are not shocking to him. Like if he sees an accident and someone's in bad shape. I'm not going to say what happened, but
Yeah.
we've seen that in the field. So a brand new police officer coming out, they see that they're like, oh my God, it's just so much for them to take in and it's quite traumatic. But my husband has seen this before.
Yeah.
As it is traumatic, he knows how to deal with it or handle it. So, and then
Yeah.
he'll
You're
come
getting
home
it from,
with it.
I'm sorry, what you saying? Sorry, it's the
And we can
delay.
come home and we talk about it because we both have that medical background or whatever. I'm a good listener. I'm like, sometimes I don't need to say anything. He'll just vent it out and then he's good. So,
Because you're getting from, it's like a double-edged sword. Like he's not a teacher or something, be going into the reserves and deploying. He comes back home and now it's more of a 9 to 5 job. He's a police officer. So
yeah.
just that alone,
Hmm.
uh, and in New York City. So
Right.
um, yeah, like you said, there's an arrest, something happens, he's away for 48 hours. And you're a
And it's
nurse.
been
That's
tough.
also not easy from him. You're gonna have
Right.
days you're gonna come home and you just don't want to talk about something or
Oh, yeah.
something's affecting you.
Yep.
So
It
yeah.
was the first year he came back after deployment. It was just a readjustment. So, and then we sat and talked. He's like, the things I've seen, the things I've done, everything, like coming back and just coming back into society again when you were away for that year and just having that regimented, like you wake up at a certain
Yeah.
time, this is your job, this is what you're doing, and you come back to normal society. So it was an adjustment for him. And he was able to get some help to just talk it through. And I think that also helped our relationship because
Mhm.
he came back and there was a disconnect and that I couldn't understand it. And you talked about resentment earlier. And I'm like, what is going on? I thought he was supposed to be happy to come back. And
Right.
then I fully understood the whole picture, of what was going on. And I'm like, okay, okay.
Yeah, and luckily we live in a time now where it's okay to talk about certain things. I
Yeah,
feel like back in the day it was like don't say anything, but of course you take it out on everybody.
right.
Your
Exactly.
kids or you're just
Yeah,
screaming, getting, so I'm glad that there's healthier habits. Yeah, I'm glad we live in a time where talking about things is more acceptable. I just did a podcast with my buddy who's deployed 4 times, three
wow.
times to combat, and he's talked it out, and he's very happy with
Oh,
what the
good.
VA provided for him. So
Oh, yeah,
always
yeah, yeah.
encouraging people, talk it out, don't be so tough. there's many different ways. I just recently gave somebody she needed, she was told she should, she was thinking about talking to somebody. I'm like, there's online resources too. You don't have to leave home. You can find somebody online. So
Right.
I used to be kind of a hard ass about that in my younger days, and then you grow up and you get older. You're like, like I say, you think you're handling it, but you're sort of expressing it in ways you don't realize it, and
Right.
other
Exactly.
people are paying the
Exactly.
price because you think you're above talking things out. So I've come to that conclusion in my old age. I'll be 44 this month. So
Oh, happy boy. Well,
oh,
happy early birthday. I just had my 41st, so
oh, hey, like I said, you look the same 5 years later from when I
thank
started
you.
working with you. I feel like I've aged 10 years, but
Nice to see.
um let me see. I just want to see what I wrote down. Anything that you want me to get into that I haven't?
No, that's pretty much it. Because I wanted to talk about like, just the transitioning of like under knowing yourself. I think one of the things a lot of people want to say, okay, I want to be a nurse practitioner. I want to go back to school. I always applaud people for going back to school. But
Yeah,
I'm like, think about what you want to do in the end game. There are different
right.
things you can get your master's in nursing. Do you see yourself as a provider? Do you see yourself going into management? What exactly do you want to do? Because you're as a provider, you have people's lives literally in your hands because you're taking care of them. You're prescribing and you're diagnosing and you're ordering all these tests for them. So, um, and I tell people this is just not a job just for money, it's for passion as well, because you really need to love what you're doing. It's a tough
Yeah.
job.
You're
Dealing
not
with
going to make enough.
people,
It's not going to be
you're
what,
never
yeah,
gonna make
it's,
enough.
it's not going to be, you're not going to get the equivalent of what the time that you're
No.
putting in. No, it's not going to happen.
It's a lot of time, it's a lot of effort. It's sometimes a very thankless job. And then there are those times you have a patient that just makes you feel like, oh my God, this is exactly why I'm a nurse. And you're not going out expecting that. And then you get that validation and you're like, okay, this is why I'm supposed to be where I am. Um,
That's
and I think,
that's a pretty important comment you just made
yeah,
because a lot of times you don't feel like a nurse or you feel like you want to ask yourself, what are we doing? Like, why do I have to, these situations arise and you feel like, you're micromanaging or you're dealing with like literally violence or
yeah,
something that's just like, this is not what I thought I was getting myself into. But then other things do occur and you're
mhm,
like, this is exactly why I'm doing what I'm doing.
yeah, exactly. Yeah. Yeah. I've been assaulted at work. I'm like, oh my God, I'm out of this place. I cannot. It's just too much. But then it's a double-edged sword. It's rewarding and it's just also just wants to make you like scream, but you know,
Yeah,
that's
it
working
is.
in
It
New
is.
York
It
City
is tough.
ER.
Yeah, because it's like when I think about, I mean, a nursing degree can go a long way. I may transition into medical sales at one point when
Right.
my
Yeah.
both my kids are um, taking the yellow bus to school because right now I'm in the trenches with two toddlers.
Mhm.
So where I work maybe once or twice a month as in the ER, but then I'm more medical sales or I'm not really sure what the future is for me. I don't know if I want to go back to NP school, but you have so many options as a nurse. But you had mentioned violence. I actually wanted to start a new thing on the podcast where I show a TikTok or something. I don't know about you. I like the whether it's humor or it's just like a rant. I like
Mhm.
nurses going online and saying certain things that whether they find it funny or they're not happy about it. I like hearing other people
Mhm.
voice these things. And
Oh,
for YouTube, I'll show the video on the screen. I'll superimpose it. But for this is from her name is I think it's K2Lee89. The video is 3 minutes and 55 seconds. I'm just
okay.
gonna play a minute and a half. Is that all right with you?
Yeah, of course.
It's about kind of related to what you were talking about. Here it
Yeah.
goes.
I'm going to say this with my whole fucking chest. Something in healthcare needs to change. I'm not sure if any of you guys have been following the news, but here, let me give you a quick recap. In Florida, a man assaulted a nurse, broke every bone in her face. They're saying that she's going to lose her eyes or her vision. In Pennsylvania, a man walked in and open fired a gun, killing officers, nurses, doctors. But don't worry, the report says no patients were harmed. In Kentucky, a woman in the emergency room stomped on a nurse's head, severely injuring her. These are just a few stories that have made national headlines in the last week or so. What people don't understand is that on a daily basis in an emergency room, dangerous behavior, assault against medical staff takes place. Any other profession, if a patient, if a person assaulted you, police would be involved, charges would be pressed. It doesn't matter if they have a psych history, if they're off medications. If somebody threatens you and physically harms you, there are consequences. I don't know when it has become so acceptable that a nurse, because they're a nurse, or because they work in healthcare, because they choose to care for people that have high acuity, sometimes mental health crisis, have to be subjected to this. It's actually infuriating. People wonder why I left the emergency room. It's not because I don't.
So it goes on, she makes other points, but that's kind of the gist of it. This is something I feel like I've been seeing more and more of. I worked with a nurse at one of my contracts who had her neck broken. She was yanked from behind and strangled and had 3 fractures in her neck. I worked at an emergency department where some male nurse was just fired. He was being pummeled. And in order to get the person off of him, he socked him one to get away, and he was fired for that. And I know I've personally been told that, if you're being attacked, you have to run. Like if you put your hands on them, they can't protect you.
Yeah.
What do you think about this? I think she brought up a good point that just because you want to go into the healthcare industry, take care of people, and a lot of these people, most of them, they're not altered mental status, or they're fully capable. They have a sense of morality. They know right and wrong. But if you hit a nurse or whatnot, nothing happens. What do you think about that?
So that's been a problem that we've been facing a lot. We've had multiple meetings and talks with the head of security. So they're trying to do, because for where we work, security is not supposed to lay hands on patients, even if we're getting pummeled to death, I guess. But so that was our biggest issue, especially after what happened in Florida. Our director, we have a new director, ER director, he would walk around and be like, do you feel safe? So he has like these meetings where he comes around and asks you a lot of the time. So the head of security in the evenings, they do rounds a lot. They've been trying to make changes right now, but I don't know what it is, but we've seen it, especially after COVID. I don't know what happened after COVID, but people do not care how they speak to you. They do not care if they're in your face. They do not care if they lay hands on you.
Yeah.
We have
I
been
think people are
threatened.
so. I'm sorry to cut you off. I think people are so. There's a lot of aggravation on, I think, COVID. It's been
Yeah.
obviously politicized, and for
Mhm.
good reason, because people did not get, if people feel like they didn't get all the information, or they feel
Yeah.
like certain things occurred that shouldn't have occurred, whatever people's reasons are, uh, that era has been so dismantled. And yeah, people don't seem very happy about in the post-COVID years with regards to medicine.
Yeah.
But yeah, I agree with you with that. People, I think they kind of associate you more with the system, and it's just
Yeah.
like, I'm just a nurse. Like I have nothing to do with the
Exactly.
system that you're not happy with.
Exactly. And that's a good point you made. There's a deep rooted like anger within that society, within society, that people are saying, yeah, it's mental health for some people. And then there's some things that are untalked about. Like there's no reason for you to come to me and be screaming in my face and being disrespectful or threatening. It's been pretty intense and scary. No one has We had one of our med techs had his hand broken a few, maybe 2 years
Wow.
ago, with like a really belligerent patient that they were trying to subdue, like just trying to just put him in like the soft restraints, but he just like yanked out of it and broke his arm, his hand. And other people, we just had a supervisor just got punched in the eye. It's just a lot. So And
But then
some
there's no consequences,
there's no
it's like if
consequences.
if I punched you in the street, I'm toast. But if I go to the emergency department, you're taking care of me, and I'm stressed or this or that, and I punch you, it's kind of like, okay, you got hit by are you okay? Like
Yeah.
what? I'm fine. I'm in full control of my faculties. I know right and
Yeah.
wrong, but that's nuts. That's
Mhm.
really kind of nuts. But if I go
It's
to McDonald's and punch somebody, I punch
forget
an
it.
employee there, I'm arrested.
Yeah. And it's supposed to be a federal offense if you assault a nurse, but there's always these, because now that my husband is a police officer, now I understand the fine lines and everything of what open fist versus closed fist and all of these terminologies that you have to use. And then of course you take it to the, when if you do press charges and then it has to go to the assistant DA and then they have to decide if they want to keep those charges or they want to lessen the charges. So
Yeah.
I feel like honestly it should never be that you hit a nurse, you hit somebody in healthcare, you physically hurt somebody, the charges need to stick.
It
So,
gets kind of crazy when they tell you that, like the example of the guy who was getting pummeled,
mhm,
punches his way out of it, then gets fired for that. He
right.
wasn't going after a patient. He wasn't like even like a regular fist fight. Like, come on, buddy. Like, I get that, but you're actively getting punched. And I don't know anything about the guy. I don't remember, but look, I mean, I'm 6'2", 250 pounds. I've been an all-state wrestler. All-state football player, all-county wrestler. I was in the military. Like, my experience is a lot different than yours,
Yeah.
uh, and a lot of other people. I mean, I've come on shift where the nurse has told me like this person was basically abusing them the entire
Mhm,
night,
yeah.
aggressive, verbally, threatening. And I'll go in there and I'll be like, look, buddy, not on my shift. This is a collaboration. I just won't come in your room. Like I can get away with and 9 times out of 10, it works. We end up being like buddies. That
Yeah.
tough love works. But yeah, there's a lot of females in this business. And for anyone to say, "Oh, that's the business they chose," it's like, yo, it's your mom, it's your wife, it's your daughter, it's your sister.
Yeah.
I don't think so.
No,
And a lot of time,
absolutely not.
yeah. And these aren't most of the time. I'm not talking about altered mental status for whatever
Right.
is going on, or I'm talking about your most of the time regular people.
Yep. Regular people. And yeah, it doesn't infuriate me when I see people say, well, this is what you signed up for. No, we did not sign up to get assaulted. We signed up to help you and to make sure that you're taken care of and whatever you're coming in for, whatever disease process we help to treat that and make you feel better. But we don't expect to be assaulted and verbally abused in the process. Like right now we have something called CPI training, which is like a crisis prevention training. So we have to do that every 2 years in case anything, just trying to get yourself out of certain situations. If you are, you know, say attacked from behind, how to get out of that and run
Yeah,
away. So it's mainly of a get out of the situation, run away. It's not a fight or flight. If you have to
yeah.
fight, throw something and then run away. Like, but they
But
don't want
it's
you to
crazy
get
that
to
if
fight
you
it
if
out.
you if you strike somebody, you might get fired. Like
Exactly. The fact
if
that
you're
that's
being actively, and I'm talking about you're getting actively beaten up,
right.
like you're getting punched in the face maybe 3, 4 times, and you're just like, get off of me, and you might get fired for that. That to me is insane.
That to me is very much insane. Like you can't even, you were supposed to just stand there and take this while you can't
Yeah.
defend yourself, maybe save somebody else from getting hurt, right? In the process.
Mhm.
So if he didn't try to like defend himself or maybe like stop and like subdue the person, then somebody else might have gotten punched as well. So why is the person who's trying to help the situation getting punished? So that to
Yeah,
me, yeah. So that's a huge problem. I feel like also in leadership and management in healthcare, they fail to realize and see that we're not just disposable. We get hit, we get pummeled, we get our eyes, that poor nurse in Florida. I think about her all the
I
time,
know. That
right?
that 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 was a very disturbing thing
That was
to read.
extremely disturbing. And just like we all talked about it, we've read the articles, we've seen this, just like, we think about it because we're like, this could be us, this could be
It
our
really could.
coworker, it could be anybody that we know. So
Yeah. And then even myself, you can't feel so, sense of security. Yeah, everyone turns their back.
yeah,
Everyone's busy doing something.
Yeah.
You don't know someone's motive. They stalk you, they wait for
Right.
the right moment, and they clobber you with something. I mean, and who knows what they have on their person? Who knows? Yeah, I just wanted to show you that and get your opinion on something like that. I have so much respect for nurse practitioners. You go through the trenches before you become an NP. Some people, they do the track, they from college but that's usually not the case. And
Yeah.
I think also, like anything else, when you get into nursing, you realize that whatever your expectations were, you were wrong.
Yeah.
It's like,
Oh yeah.
even after
Absolutely.
school, even after school, and that's going to shape what kind of nurse practitioner, what field as a nurse practitioner you want to go into, or if you even want to still do it, or whatever it is. Yeah, I'm still wondering. Jeff Bezos said something. He has a good quote. He says, "If you think you're going to regret it in 10 years, then do it." And so that's kind of like where I'm at. I'm like, if I am I going to regret this in 10 years? For me, I'm a travel nurse. I do local
Yeah.
contracts. So for me, I also need to become a staff nurse again because I do want to use tuition assistance.
Right. Yeah.
And yeah, but I want to thank you, Anastasia, for doing this. Taking the time out. One of my favorite things is catching up with people that I
Uh,
know. You were one of the best nurses I've ever worked with, and one of the
okay.
best charge nurses, certainly. You and Shika.
Oh yeah, Chica's amazing. Yeah.
Because I had a Shika or Anastasia, it was always a good shift for me.
Oh yeah.
And I've grown a lot since Queens, but Queens that's the foundation, the standard I always use. And most of the time I feel spoiled because I can compare it to the patient load we had in Queens. But
Oh yeah.
still
For sure.
the best bunch of nurses I ever worked with
Oh,
were
thank
you.
you. Thank you. Yeah, they're amazing. They're definitely amazing. I love them.
So thank you very much, Anastasia, for doing this.
Of course, no problem. Thanks.
Oh, welcome back, folks. Skull. Yeah, that was quite a conversation with Nurse Anastasia, NP Anastasia. People's journeys fascinate me. For example, in that same emergency department, I know of a nurse, and he came from nothing, and he was a great nurse. He went to medical school while I worked with him, and now he's a doctor, also from that emergency department. Again, people's stories are fascinating to me. She was born and raised, in New York, and I think she inherited a house here. She got married and she moved to Missouri. But once a month, she would fly to that house. I'm not sure if she rented it out or anything. Probably not. And she would stay there and she would knock out all of her per diem commitments. So, like, I don't know, 3, 4, 5 shifts in a row. And then she would fly back to Missouri. Yeah, so people's stories are amazing. I feel like a shaggy dog by comparison. I mean, I I was well, I'm going to make a video about this, but on February 26, 2000, I had a near-death experience. I do not recommend falling asleep behind the wheel of a car. I did. I don't remember them cutting me out. All I remember is waking up in the hospital with 15 staples in my head, bruises. I still have a dent in my arm from that accident. And I saw my dad and I said, shit, I did not want to be back. I went through a depression after that. I mean, this whole big thing I'll get into maybe in a separate video. And right when I was figuring it out, 9/11 happened. September 11th, 2001, the attack on New York, specifically. I was 20 years old and I really connected to the city. And so when people were telling me that New York was over, it was like they were telling me I'm done. And I had just been going through this whole thing, and I defied that. New York is not done, and I'm not done either. I'm just getting started. So I went to Bartenders Academy, 2 weeks of that. I enrolled in New York Film Academy, a 3-month intensive workshop. I think at the time it was $2,500. It was located in the old Tammany Hall building in Union Square. I think it's a condo now, sadly enough. They kept the outside of it, but it's gutted. And I knew nothing about New York City, even though I lived out in Eastern Long Island. All I knew is that you take that Long Island Railroad to New York City, you can walk to Times Square, or you could take the N train to Union Square, where New York Film Academy was. That's pretty much what I did, and I eventually got a bartending job in the city. Eventually moved into the city with a high school friend of mine. Uh, did the small film thing, wrote, directed little projects, mostly bartended, mostly bounced. Until 2008, the housing collapse. I was working at a nightclub. At this point, I was a bouncer. There was a EMT. It was a huge nightclub. There was an EMT. The club had its own EMT, and the manager said on this particular night there was some guest DJ, 4,000 people. Why don't you shadow the EMT? And so I did. And it was kind of amazing to see this guy deal with the intoxicated folks and the meth heads, as we called them. Nothing exceptional, just making sure they're hydrated, taking out his pen light, doing Perla, telling me who I can kick out, who we have to hold on to for a little while. And I was transfixed by this person taking control of the situation. Also, in the background, I loved science, and I was always good at that and biology. And yeah, I decided then and there, there was a economic catastrophe occurring, in the housing market, at least in the United States at the time. So joining the military didn't seem so bad. And so I did that, joined the Navy, knowing I was going to become a Navy hospital corpsman, and used the GI Bill to go to nursing school. That process took 10 years because the enlistment was 5 years. And even though the military, while you're in, you can go to school on tuition assistance, I was with the Marines a lot in the field, and that just was not my destiny. I could not complete a degree um, while I was in, uh, even though I had 2 years of college already. So yeah, I got out, went to nursing school in the GI Bill. I also used the Yellow Ribbon program, and that took 10 years. That was so that's my journey, which is not done because I don't see myself as just being a nurse, I, which is uh, which is not done because I don't see myself remaining a bedside nurse. I don't know if I want to go into medical sales. I don't know if I want to go back to school and become a nurse practitioner. I had mentioned earlier in the podcast, Jeff Bezos saying, if you think you're going to regret something in 10 years, then do it. So I know I need to make a change or I will regret it. But on the note of a career change or picking a career, I just wanted to put something out there. A lot of people talk about their goals and what they want to do in life, what makes them happy. I always take that into consideration, but I also want to point out that you also have to know what problems you're willing to cope with. Say medical sales. I know the benefits of it. I know the work involved, but you have to consider you're probably going to work 5 days a week. Work will probably follow you home. As a nurse, as a bedside nurse, I do enjoy the fact that nurse can't follow me home. I can't treat patients at home. When I'm home, I'm home. That's nice. So am I willing to put up with having to do work at home? Okay. Maybe on the weekends on my off days, since I don't think well, you may work on the weekends in medical sales. Who knows? You get turned down a lot. At least in nursing, you're performing tasks, you're critical thinking. There's going to be an outcome, whether it's positive or negative. There's going to be a road that continues. It doesn't stop, right? What else? What other problems with medical sales could there be? PowerPoint. Am I going to have to make a whole bunch of PowerPoints? Am I going to be sitting down a lot? I mean, I'm a big guy. I never fit into anything. When I wear a suit, it's like the end of the world for me. That's why I hate going to weddings or hate dressing up formally anyway, because I am never comfortable and I'm always paranoid every time I sit down or move around that I'm going to tear something. God forbid, right? So these are things to consider. These are problems that I have to look in the mirror and say, am I willing to have these problems? I'm certainly willing to enjoy the benefit and even do the hard work. But am I willing to take on these problems? Even as a nurse, right? The emergency department has a lot of problems, but ER problems are problems I'm willing to deal with. If I were on the floor, hey, I've done the floor. I worked in telemetry for a brief period of time. I don't particularly like going to work for multiple shifts in a row, not necessarily consecutively, and seeing the same patient. I don't prefer that. That to me is a problem for me, and I don't want to deal with that. I like the idea of new patients coming in. I like the idea that even from going even from starting my shift at 8 a.m., by the time 8 p.m. happens, or if it's 7 a.m., 7:30 p.m., whatever it is, I may have an entirely new group of patients. And I like that. I like that a lot. So, yeah, consider your goals, consider what you're willing to do, the benefits, but also consider what problems you're willing to deal with. Because if you're not willing to deal with the problems of something that you think you want to do, maybe you should choose a different path. Because even if you love doing what you're doing at home and you want to make it a career, at the end of the day, after years go by, it's going to be the problems that gnaw on you. It's going to be the problems that you are feeling more so than anything else, because life is conflict. Life is a struggle. It has to be. It has to be. That's the only way we acquire truth. And truth is something, we use terms like my truth and his truth. There's only the objective truth. And if you're lucky and you put in all the work, you may on occasion scratch the surface of truth. And it's a wonderful feeling to know, hey, this is something that's objective. This is something that is universally true. It's an axiom. It can't be disputed. And here I am holding this thing or touching this thing. But it takes a lot of work. And you have to struggle. You have to struggle to achieve that. So there's always going to be conflict. There's always going to be struggle. Just make sure that you're struggling with things that you want to struggle with. Because boy, when you're stuck in a rut and you're dealing with things you don't want to struggle with, even as a Navy hospital corpsman attached to the Marines, I'm aware that I may be working 4:30 in the morning, conducting an exercise at night, sleeping in the field for days in a row. But I'd rather deal with that because it comes with the camaraderie, comes with a high level of responsibility. I'd rather deal with that than going to a hospital in the Navy and sitting down or just feeling like I'm not as busy as I could be, or I'm working with people who here I am trying to work hard and do something, and somebody does a bake sale or does the command Halloween party, and they're getting promoted. That does happen. Or the bureaucracy. You're closer to the bureaucracies, or to some micromanager who says, "Oh, you have nothing to do? I'll find you something to do." I know that when I'm with the Marines, when I take care of business, my time is my time. And again, you pick the problems you want to deal with. But that's my 2 cents. Thank you, everybody, for listening, for watching. Again, please like, share, and subscribe and comment. It helps this channel out against the algorithm. Call me Glenn, call me Nurse Dad, whatever you want to call me a jerk off. I don't care. Thank you for watching. Stay hungry, be humble. Nurse Dad out.
Hello, folks. I hope you're enjoying the interview. Before we go back, let me announce I wrote a children's book, Isabel Learns to Share, a love letter from me to my firstborn daughter, Isabel. It's available on Amazon, but let me be clear. In a world of AI, this book is written by me, every word of it. Everything this book earns goes right to the podcast. This book emphasizes family values, respects parents, and respects children as they go through life making mistakes, but ultimately learning how to become their best selves. Click the link down below, support the podcast, and get yourself a copy. Thank you very much.